everyone, this is Alraies from Phoenix from SCAI 2023. I'm really privileged today to be with Dr. Sadaf Fakhra. She is a chief resident as well as going for cardiology pretty soon, and she's a presenter at SCAI 2023. Sadaf, thanks for being with us.
Yeah, thank you for having me.
Yeah, so you're presenting a project related to structural heart. Walk us through the idea, the title, and the idea where it came from.
Yeah, so I'm presenting on left atrial appendage device closure, Watchman, and we're looking at complications for patients younger than 65 and older than 65. The motivation behind the study was these devices are becoming pretty common in patients that have high complications with anticoagulation, but there aren't a lot of studies looking at age differences or patients that are elderly having more complications getting these devices in. They're relatively considered pretty safe devices to put in. So we used the NRD database, looked at 2016 to 2019, and looked at all the patients that received the Watchman device, and looked at in-hospital complications and post-procedural bleeding and tamponade to see if there's a difference based on age. We also performed propensity matching to help account for any differences in baseline comorbidities.
Yeah, especially it's very rare, or not very rare, it's less than 65 is considered a more healthier population compared to more than 65.
Yeah.
Again, this is just a random cutoff, but I think this is where the kind of complexity of the patient gets worse.
Yeah, absolutely.
Yeah.
So we had a good number of patients that met our inclusion criteria, about 60,000, pretty even distribution of male and female, about 58% male, 42% female. And we did find that although the complications are still very low, regardless of age, patients more than 65 had higher vascular complications, post-procedural bleeding, tamponade, and sometimes AKI as well, which we would expect when they're older. They have higher chance of being frail, and they can have more complications in patient. Yeah.
Do you have any echo data about these patients based on the data?
Unfortunately, we don't have echo available in our NRD, but this would be something that, when published, can be taken into like a single center trial looking at echo data and be taken further so we can apply it even further into clinical practice.
Well, congratulations for your presentation at the SCAI. Please watch these videos and others on SCAI TV. This is Alraies from Phoenix. Thanks for watching.
Thank you, Dr.